Low-lying placenta. This is a term that many pregnant mothers hear often during their scan checkups. So let us discuss what is a placenta and what do we mean by a low-lying placenta and the do's and don'ts when you have a low-lying placenta in this particular video. Hi, I am Saranya. I am a birth professional and a life coach for mothers. I'm also the founder of Babypedia. So first let us see what is a placenta. So the placenta is basically an organ that gets formed as soon as your baby gets fertilized. So when your baby is formed, then what happens? These cells will divide into two. One will become the baby, the other will become the placenta, and the umbilical cord connects the baby to the placenta. Now this placenta will go and attach onto the wall of your uterus, like how a tree grows and its roots attach into the soil. Now it can attach on any part of your uterus, the top, the left, the right, the front, the back, the bottom part of your uterus, anywhere. Okay, so now based on where this placenta is attached, we will call different positions. We will say different positions for your placenta. Now this placenta is a very important organ because it is ensuring that your baby gets all the nutrients from your body. It will absorb all the nutrients from your blood and pass it on to your baby. And when your baby sends all the waste material through the umbilical cord, it will take that waste material and send it to your body. So this placenta, as long as it is healthy and functioning well, rest assured your baby is getting all the nutrients it needs to grow into a very healthy baby. So that is the importance of the placenta. Soon after birth, once your baby is born, the placenta has no other work remaining in your body. So the placenta will also slowly detach and you will expel the placenta after you give birth to your baby. Okay, so now let us discuss what is a low-lying placenta. Now I told you the placenta can get attached to any part of the uterus, right? So when your placenta gets attached to the top of your uterus, that is the fundus of the uterus, this is called the fundal placenta. If your placenta gets attached to the front part of your uterus, that's towards your stomach, then this is called an anterior placenta. If it is towards the back, towards your spine, that's called a posterior placenta. And anywhere to the sides, it can also be called a transverse placenta. Now, if your placenta gets attached anywhere near or even on the mouth of the uterus, or the opening of the uterus is called the cervix, then this is called a low-lying placenta. So if your placenta covers the opening, then this is placenta previa. If it covers it fully, if it covers it partially, then this is called partial placenta previa. If it is anywhere near the mouth of the uterus, it's not covering, but it's near the edge, somewhere 2 to 3 centimeters near the edge, then this is called a low-lying placenta. Now this carries some risks. If you have a placenta previa or even a partial placenta previa, then your doctor would recommend going for a cesarean because it is very risky to have a vaginal birth. If you have a low-lying placenta, especially if it is noticed in the earlier part of your pregnancy, your doctor may ask you to wait and watch because as your uterus expands, when your baby is growing and your pregnancy progresses, there's a chance that the wall of the uterus will move and so the placenta will also move away from the cervix. So then your doctor may recommend, having a little bit of bed rest, only walking when necessary, not lifting weights, no exercises, and a lot of other recommendations based on what is the degree of your low-lying placenta. Follow these instructions strictly because yes, it is a risky thing. Okay, not very risky, but there is a little bit of risk to having a low-lying placenta. And once you go for your next scan and the placenta has moved up, then your doctor may change their recommendations and let you start exercising and do all your normal work. So let us wait. And one common question that mothers ask me, is there anything that I can do to move my placenta? No. There's nothing that we can do to help the placenta move. You just have to wait for the pregnancy to progress, your uterus to expand more to check whether the placenta is moving or not. Okay, so the best thing that you can do is listen to your doctor, follow their advice till the next scan, and let's see whether the placenta moves up or not. So I hope you got a lot of information in this video. Don't forget to hit the like button, share it to another pregnant mother who's worried, and subscribe to the Babypedia channel to get more updates on trying to become pregnant, pregnancy, birth, early parenting, and breastfeeding. Take care. I'll see you soon in another interesting video. Bye-bye.